Hi, thanks for joining us today. I'm Michelle with South Mountain Works Coalition, and I'm here today with the chair of our coalition, Dr. Bill Beverly. Thanks for joining us.
My pleasure.
Want to say a few words about your background and who you are?
So I'm a licensed psychologist, a licensed marriage and family therapist. I got close to 20 years in the behavioral health field. My full-time gig is I'm a faculty member and director of behavioral health sciences at South Mountain Community College, which is how I came in contact with the coalition a couple years ago. And I've had the privilege of serving as vice chair and chair of the South Mountain Works Coalition. It is the highlight of my professional life, being able to partner with such dedicated individuals that are working to improve the lives of children and families in the South Mountain community.
Awesome. That was so lovely. So we're talking about trauma-informed care, community building, and harm reduction today. Just to start out with, let's define what trauma-informed care or trauma-informed community building even is.
Yeah, so trauma-informed care means treating the whole person, taking into account trauma and the resulting coping mechanisms when attempting to understand behaviors. And so trauma-informed care is more so a lens through which we view our work that then guides our practices when we are engaged in any treatment with communities that have high levels of trauma. Trauma-informed care is essential to effective service delivery in behavioral health and community services because of the strong relationship that exists between trauma and all sorts of adverse health consequences. So it's pretty well documented now that early childhood experiences have a profound impact on the way we think, act, and feel. Those early childhood traumatic experiences happen at a time of brain development and social development, where we see actual circuitry changing in the brain. It's an adaptive thing that we have this thing called plasticity, right? That the brain can adapt to its environment. But when that environment includes traumatic experiences, the impact ends up being lifelong and severe. That is what trauma-informed care is. It's recognizing the impact of trauma on the way people think, act, and feel, and then it leads to a better understanding of how to effectively treat mental illness and addiction.
So how does that trauma-informed approach then start to help the coalition support that South Mountain community, like in more concrete terms?
Well, what ends up happening to folks who have experienced trauma and also have historical trauma in their community is they are often re-traumatized by the very service institutions that are designed to serve and protect them. So whether it's the police force, the behavioral health system, the jail and prison system, or the schools, when we're not trauma-informed, we end up implementing policies and practices, deliberate or not, that end up causing suffering to people who have traumatic experiences in their life. So at the criminal justice level, you could have a trauma-informed approach that takes into account how we do cell searches and how we touch people, how we slam doors. If it was a trauma-informed approach in a group home, it would be if you had to search a kid's room, doing it with him, present. That's collaboration, one of the principles of trauma-informed care, also transparency and building trust. So when I remember working at a group home when they actually went through a kid's belongings because they suspected he had a pipe in there. But for this kid, when people were entering his room without his permission as a young child, it caused horrific experiences for him that last to this day. And unaware folks that think they're just doing their job re-traumatize a kid. Then the kid acts out, by the way, and ends up in a restraint, and we say, oh, why is he acting like this? Instead of what happened to him. A trauma-informed thing in the schools would be how we address discipline. and how we integrate social and emotional and mindfulness types of interventions that can help create a readiness to learn, sensitive to the hyper arousal that so many young kids bring into the classroom because of the traumatic experiences that they've had at a young age.
Also, so it's really
part of
an awareness. Yes. What I'm hearing is really an awareness of the whole person and your approach to that whole person, rather than just taking that isolated instance or action that you see right in front of you at this moment.
Yes, and the other thing that it provides is that awareness leads to principles that need to guide our work. So at South Mountain Community College, and we're reopening our campus, right? We need to make sure that we're doing that with transparency and openness. We need to make sure that when people come back to our campus, they feel safe. And we also need to make sure that we are empowering people and giving them a voice in the process. Mm-hmm. For the coalition, many of our activities that we do, or what our partners are doing who are trauma informed, is ensuring that there's collaboration with the community, giving the community a voice, which marginalized and disenfranchised communities often don't have, and then empowering community members to be able to not just cope with trauma, but also to break the cycle. You see, when we talk about ACEs and trauma, when someone has those experiences at a young age, what ends up happening is their kid now has 4 or 5 ACEs already.
Can you define ACEs just really quickly?
Yeah, so ACEs are adverse childhood experiences that are traumatizing in nature and are related to multiple health-related problems. One being addiction, another being mental illness, and then all sorts of other things like hypertension, high blood pressure, diabetes, asthma, and early death. And some of the ACEs are things like, sexual abuse is one of the ACEs, and about 2/3 of people with an addiction have a history of sexual or physical abuse. But here's the other piece, and this gets into harm reduction. Because we treat addiction as a criminal justice issue and not a public health issue, what happens when someone gets, well, let me take a step back. So when someone has a high ACE score, they're more likely to have an addiction. Mm-hmm. And that addiction in our country is going to land you in jail. Now, what does that lead to? Your offspring, if you're that individual, now has, when you look at the 10 different ACEs, they have a family member with an addiction. They have the loss of a parent due to incarceration. They have a parent who is likely struggling with mental illness, be PTSD, clinical depression. The comorbidity between addiction and mental illness is very well established. The offspring, because they have an incarcerated parent, is more likely to experience emotional neglect and physical neglect. And then another ACE that's going to be likely there is parental separation or divorce, or people not being together anymore. That's what happens when someone's incarcerated. According to the Federal Bureau of Prisons, roughly 50% of people that are in federal prison are there for drug offenses alone. So we incarcerate a vast number of individuals who struggle with addiction, who have historical trauma in their lives, and much of their addiction is fueled by traumatic experiences that have limited their coping skills and caused great pain to themselves and their community. But I just rattled off about, I think, 5 or 6 ACEs that are very likely to follow if we incarcerate someone with an addiction that stems from early trauma.
There was 4 solid ones. And then when you're talking about trauma-informed care and harm reduction, I feel like you just started to make that segue. Can you clarify that connection even more?
Yes, so harm reduction is a set of principles, policies, programs, and practices that aim to reduce the adverse health, social, and economic consequences of drug use. And harm reduction does not harm reduction does not condemn, nor does it condone drug use. What it does is it meets the person where they're at, but it doesn't leave them there. And it helps empower people to make healthier choices and safer choices with their lives, not with a punitive approach, but with a collaborative, strength-based, egalitarian approach where you meet people right where they are at in their lives. And we use harm reduction in so many instances in our culture. It's when this is where stigma comes into play. If you see a alcohol commercial, you're going to see at the end of it, please drink responsibly. If there is a bunch of parties going on, or it's Memorial Day weekend or something like that, you don't hear people say, do not drink. Drinking is associated with major health issues, and it's related to child abuse and domestic. But no, we don't say that. We say, if you're going to drink, don't drive. Just like if you're going to use heroin, don't use a dirty needle. But that's where stigma comes into play. So another example is if you go see a doctor for your weight or your diabetes, they don't tell you to have the diet of an Olympian or a professional athlete. They get you maybe taking a walk in the morning. They don't require you to have lost 40 pounds in 3 months in order to be someone who's healthy, but rather take certain initiatives to better care for your physical and emotional health. So harm reduction is treating addiction through the lens of community health and not punishing people for having a healthcare issue, but meeting them where they're at, but not leaving them there.
That's amazing. Thank you so much for sharing all of those thoughts with us. It sounds like the coalition, I know from working inside with the coalition and working with you, that we offer those community supports, and that's one of the main aspects, right? We have 12 different fields that we're looking at when we're looking at our community. And it's not just isolated on substance use disorder, but preventative factors, and then meeting them on the other side if they do abuse substances. Thank you for sharing all those thoughts. We definitely look forward to the live panel with you, Chris Abert, and Dr. Cessna. That'll be coming up in just a few days. Thanks for joining us this morning.
Yes, and if I could just add one more thought. When I rattled off all of those adverse childhood experiences, or those ACEs, an incarcerated parent, physical or sexual abuse, a parent with a mental illness, those are what we call static risk factors, meaning if someone's experienced abuse as a child, you can't undo that. So a lot of people feel powerless when we are talking about ACEs. And I just want to remind folks that the most common adverse childhood experience that our South Mountain youth experience is emotional neglect and emotional abuse. And so that is a dynamic risk factor, meaning we can create meaningful connections with members of our community and empower folks to connect with youth, and in doing so have a profound impact on people's lives. So I want to encourage folks not to feel defeated or cynical when you are taking into account how much folks have had to endure in our community. Given that the most common ACE is the emotional abuse, we are in a unique position to be a positive force in the lives of youth and our community members to help facilitate healthy change and growth. I always want to remind folks of that, because folks hear this stuff and they're like, it's enormous. They don't feel like they can do anything about it. It's the massiveness is hard to overlook. But then when you realize that there's an opportunity for you to be a positive force in other people's lives, and it's in the lives of youth where they don't have a lot of that,